Hey, this is Dr. John Blenio with High Amplitude Health, and just wanted to go over how to roll your hips properly. I get a lot of patients who come into my office who have low back pain, and a lot of their problems occur, their low back pain occurs because they have tight hips, tight glutes, tight hamstrings, quads, hip flexors, even low back muscles. And so 90% of the patients that I see, their back pain is caused by tightness more than any structural problem with the joints in the low back or the discs between each joint in the back. So anyway, one of the best things that you could do is roll the glutes. The glutes, especially the glute medius, are a major contributor. So, to roll the glutes, the way I like to start off with is, so this is one of those, I don't know, that's like a 24-inch foam roller. You can get these at Sport Authority. What I do is I just start on it like this, okay? I kind of get my hands on the knees and I'll just roll. And I'll roll pretty much from the butt bone where the hamstrings meet that bone, right? It's called the ischium. And all the way up to kind of the tailbone. And usually I find something tight that's a little higher, right? A little higher up on the glutes. Okay, so that's just a good way to start, to kind of just get things loose. And then after I've done this for a while, I will go to one glute at a time. So I'll straighten the leg on the right glute here, right side, and now I'm just trying to get in on that glute. When you're rolling, it's all about angles. Just remember that. So I can come at a slightly sharper angle and get the glute, just like this. I can kind of flatten out a little bit more. And what you're looking for when you're rolling is kind of that hurts good feeling. It can't just hurt. If it's hurting too much, then what I want you to do is drive your foot into the ground and drive your arm and literally kind of lift yourself up. And now I can modulate, right? Now I'm going much lighter, but I can just kind of have all my weight on here and roll. That can be really tender for some people. I roll a lot, so it's not as tender, but it has been in the past. So here I'm rolling the glute. You can see me getting in there, okay? And now I'll kind of come onto the side, and there's a muscle here right on the side. It's below your hip bone and that bone on your leg. And we'll get in here. Let me come this way a little bit. And that's the tensor fascia lata muscle right on the side. That's a abductor and hip flexor muscle. Okay, TFL for short. Okay, and then I'll work in here, and I'll like I said, it's all about angle, so I'll slowly kind of just roll on that side, get in there. Now I'm getting into the hip flexor, the actual hip flexor in the front. What I'll do is I'll get down onto my shoulder, and again, if you look at the angle of my body here, I'm kind of almost like at a 3/4 angle, and I'm trying to get in on that hip flexor, right? So there's a bone right here called your anterior superior iliac spine. You'll feel it. You want to go right below that bone. That's where that hip flexor is. So you get in there. Like I said, get your shoulder on the floor, okay? Not like this. You can get in there relatively deep, but I find that if you lay, even more of your weight can get in there. And again, if it hurts too much, sure, you can use your arm to lighten up the amount of pressure, the amount of your weight that's going into the foam roller. And, you know, you can use this foot too to kind of hold yourself up, prop yourself up, all right? So I'm getting in there pretty good. That's the hip flexor. And again, it's all about angles, right? So I'll just kind of tilt and right. Oh, yeah. That's a good spot, right? At that angle for me. Feels really good. And then I'll move a little bit. Whenever I'm closing my eyes, you can tell it feels really good. So And again, if I come to this angle, I don't feel it as much in the hip flexor, but if I just come forward like that a little bit, now I can get in there, okay? So that's the hip flexor I just showed you, and the glutes, how to roll the glutes. Let's get to the quad. So what I do is I'll get one leg up. So if you look at me from the front, this leg, quad goes flat right on there, and then I kind of crab this right leg out if I'm getting my left leg, okay? And I'm sitting there and rolling. Let's do it from an angle here. Sorry, you can probably see me better now. So I'll get, let's look at my quad here. And I'll get that right on my quad, okay? And now I'll just roll, okay? And that right leg is out at an angle, and I'm propelling myself with my elbows and that right leg right now, okay? And if we come to the other side, you can see it. I'll do that same left leg, okay? We're getting the, look at how my right leg is kind of crabbed out there, and it's kind of my propulsion system along with my arms. So I can really roll that quad. Okay, now we'll get the IT band. Okay, now I can be straight on the side, getting the IT band, just like that. And again, if this is too painful, remember, drive that foot into the ground, drive this arm or this arm, and you know, I can lift myself up here and control how much of my weight I want to put on it. Okay, so roll away. You'll get a little workout doing this too, okay? Sometimes I like to move it. One of the hottest spots in the IT band and the quad is a little closer to the knee, okay? So I'll roll down there, and that's tight, and that feels good, hurts good. You're always looking for the hurts good. It shouldn't just hurt. If it just hurts, you're doing it too hard, okay? So roll the quads. Okay, it's again all about angles. Get onto the side. Okay, I can even go all the way back. Now I'm working the hamstring a little bit. Okay, you can see me getting in there, right? Still a little bit of the IT band, but with the hamstring now. Okay, now I can get the hamstring itself. So I'm using my right leg to kind of prop myself up. And again, remember, get down near the knee, okay? Just above the back of the knee. That's usually a very tight spot. Work that in there, okay? I'm balancing myself with my left arm, and I'm just kind of keeping this left leg airborne right now, okay? And let's see. So these are going to really loosen. Let's go to the glute again. These are going to really loosen up the hamstrings, the quads, the IT band, and the glutes, to get in there and relax these very big, powerful muscles, right? The glutes and the hamstrings are very strong, very powerful muscles, right? They're the sprinters. You know, Usain Bolt, I mean, his hamstrings and his glutes are just incredibly powerful. And because of those very powerful muscles, they are very powerful muscles. They exert a lot of force on the low back if they get tight because they're so big and powerful. And then what will eventually end up happening is your low back gets tight. And it'll get tight, and you can handle that for a while, and then it'll eventually fatigue, and then it goes to pain, right? So, and that's just all caused because your glutes and your hamstrings are so tight. At least in most of my patients, right? Probably 90% of the people that come into my office, their low back pain is not because they have some disc bulge that's the problem or joint degeneration. It has more to do with the muscles, okay? So don't worry when you have low back pain unless it's absolutely excruciating and you can barely move and, you know, it's making you sick to your stomach. Okay, so we got the glutes here. Now what I like to do is get to the low back. So I'll sit on the floor, okay, and I will lay back on it, and I'll get just above my hip bone and below my ribs. You have to be careful doing this. Look at how my legs are so I can kind of control myself. And I'm going to relax on it, and I'm going to tilt, and it's just a little bit of a movement. As I tilt more closer to my back, I get on these lumbar muscles right here on the left side. So I'm on my left side right now. Everything that I'm doing, just so you know, this applies to both sides, okay? But I'm working on my left side here. And if I roll right out here to the side, it's not going to be as effective. It helps, but you want to get on those lumbar muscles close to the spine, not on the bone, not on the spine. Okay, so now I'm laying and I'm just kind of moving my body in a way that just really kind of works those muscles. I can go forward and backward. I can go twist side to side. Okay, so this is a great way to loosen up the low back muscles and bring yourself some relief, okay? Another good thing to do too is the pigeon stretch, right? We've all seen this, right? You take if we want to stretch the left glute, we take the left leg, put it onto the right knee, and then you reach forward, grab your right knee and start to pull it toward yourself. And I feel a nice stretch all the way up here, all the way. So this is a good one to do, okay? Come to the other side, same thing, getting a good stretch. So this is really, really good to loosen up the low back, okay? My name is Dr. John Blenio. I'm with High Amplitude Health in San Mateo, California, and just trying to help some people out. Take care.